Let's talk about the internal nose. So internal nose is divided into right and left nasal cavities by nasal septum, and the nasal cavity is going to communicate with the exterior through the nares or the nostril, and it is going to communicate with the nasopharynx through the posterior nasal aperture or the choana. Each nasal cavity consists of a skin line portion, which is a vestibule, and a mucosa line portion, which is the nasal cavity proper. Let's talk about the vestibule of the nose. It is a part of the internal nose, as we can see here. The anterior and inferior part of the nasal cavity is called vestibule. It is lined by the skin and it has sebaceous glands, hair follicles, and the hair are called vibrissae. Its upper limit on the lateral wall is marked by limen nasi, which is also called the nasal valve. The vestibule is lined by stratified squamous keratinized epithelium. So the nasal valve is sometimes called the internal nasal valve. The upper lateral cartilage meets the nasal septum in the midline, forming an angle of 10 to 15 degrees. This is the narrowest area in the nose and plays an important part in regulating the flow of air into the nose. Physiologically, it provides resistance to the flow of air, and it helps in filtration, warming, and humidification of air. During removal of hump and medialization of the nasal dorsum in rhinoplasty, the function of the nasal valve or the internal nasal valve gets disturbed leading to nasal obstruction. Next is the nasal valve area. It is a cross-sectional area at the level of the lower border of the upper lateral cartilage, corresponding part of the caudal septum and the head of the inferior turbinate. It measures about 55 to 73 millimeters. So this was all about the vestibule. Now we are going to study the nasal cavity proper. It has a lateral wall, medial wall, roof, and floor. Now let's talk about the lateral nasal wall. 3 and occasionally 4 turbinates or conchi mark the lateral wall of the nose. The conchi or the turbinates are scroll-like bony projections which are covered by mucous membrane. The space below the turbinates are called meatuses. So first of all, let's talk about the inferior turbinate or the inferior concha. It is a separate bone, and below it, into the inferior meatus, opens the nasolacrimal duct, which is guarded by a mucosal valve called the Hasner's valve at its terminal end. It is a very important MCQ that inferior turbinate is a separate bone. However, the superior and middle turbinate are part of the ethmoid bone. Okay, now let's talk about the middle turbinate. It is part of ethmoid bone, so it is also called ethmoturbinal part. It is attached to the lateral wall by a bony lamella called basal lamella. So this is the middle turbinate, and it is attached to the lateral wall by a basal lamella or ground lamella. Its attachment is not straight, but it is in an S-shaped manner. In the anterior third, it lies in the sagittal plane, and it is attached to the lateral edge of the cribriform plate. In the middle third, it lies in the frontal plane, and it is attached to the lamina papyracea, while in the posterior third, it runs horizontally and it forms the roof of the middle meatus, and it is attached to the lamina papyracea and the medial wall of the laterals of the maxillary sinus. An easy mnemonic for the attachments of the middle turbinate are going to be SCA, or skull can always. So first of all, we have the sagittal axis, then coronal axis or the middle 1/3, and the axial axis or the posterior 1/3. So sagittal axis is going to attach to the base of the skull, specifically the lateral lamella of the cribriform plate, and middle 1/3 portion is going to attach coronally or in the frontal plane to the lamina papyracea, and in the posterior 1/3 it is going to attach in the horizontal plane to the and it is going to form the roof of the middle meatus, and it is going to attach to LM. So L is going to be lamina papyracea, M is going to be the medial wall of the maxillary sinus. So the ostia of various sinuses draining anterior to the basal lamella will form the anterior group of paranasal sinuses, while those which open posterior and superior to it will form the posterior group of the paranasal sinuses.